Good morning. I'm Dr. Wally Taylor from Texas Integrative Medicine in Austin, Texas, and my practice is now a member of the Forum Health group of integrative and functional medical practices from around the country. Today, it's my privilege and honor to be able to talk with Pam Krewson. Pam is a clinical hypnotherapist who has been practicing here in Austin for 13 years. Pam has a bachelor's in psychology and a master's in counseling from the University of Kentucky. I think you'll be able to notice her accent just a little. And she's certified as a clinical hypnotherapist and a Blissborn educator. Pam uses the time-honored healing technique of hypnosis as an adjunctive approach to clear psychological and medical issues. And boy, is that timely for what we're going through right now. But Pam, I'd like to start off by asking you to tell our viewers today, how you got interested in what you're doing here in Austin.
Okay, so I originally, when I went to school way back when, I got my master's in counseling and knew that that's what I wanted to do and used that in my first job out of school. But, as time went on and life happened, I ended up getting farther and farther away from that and ended up out in the business world in high stress positions. And in 2006, I was in a position where I was jumping on a plane every single week, flying somewhere. Did not like my job at all, very unhappy and full of stress. And I knew I had to make a change. So I knew that what I wanted to do was go back to my roots of counseling. But I really felt like I wanted to find something that would help people actually make the changes that they wanted to make, because I think talk therapy is very beneficial. It helps you get more clarity and more understanding of your issues, but a lot of times in talk therapy, people don't actually make those changes in their life. So I didn't know exactly what that was going to be, but I started a course in coaching. And while I was working on that course, I actually sat down one day and was watching Ellen. I was cheating. I was taking time off. And she was talking about a very meaningful change she had made in her life. She had quit smoking. And she was in tears. It was really an emotional segment because she'd hidden that for years. And it was so meaningful to her that she had finally been able to kick that habit. And she had quit with hypnosis. And I was like, oh, bingo, the light went on. And I started looking into hypnosis and ended up signing up for a course, a really thorough course in Santa Fe. Went to Santa Fe and studied hypnosis, and I've been doing it ever since, and I love it.
That's awesome. So Ellen was kind of your catalyst. That's a really cool story. So Pam, tell us, if you would, what are the types of issues that you work on with your clients typically?
So I work on a full range of issues. I work on helping people develop a healthier lifestyle, whether that's, somebody who needs to start exercising, whether they're not sleeping well and they need to improve their sleep. Obviously, eating issues go along with that. So lots of healthy lifestyle kinds of things. I also work with people just in terms of changing habits. And that's letting go of smoking, maybe, or any myriad of habits. Procrastination, that's a big one. And then I also work with people just in terms of personal growth, self-confidence, self-esteem, public speaking, and even sports performance, that kind of thing. But honestly, I work more than anything else with anxiety and stress.
Sure.
Yeah, because it's just part of society today.
I think more, yeah, more today than I've ever seen in the past.
Absolutely. Yes. This whole pandemic has um, just shifted things so dramatically for people and so suddenly that it's really ramped up, I think, people's stress overall.
And not a lot of people know this about me, but when I was a young doctor in training, I was having some real hurdles with public speaking. And of course, we had to
Mhm.
do that a lot as medical students and medical doctors in training. And I actually got some help through hypnosis back in those
Oh,
days. That was really helpful to me. So yeah, I've personally seen the value that this can play. I'm curious, do you work with all ages or is there a typical age group that you like to work with?
well, I work primarily with adults, but I do work with kids in certain situations. Generally from about the age of 5 or 6 up, but below 5, they really don't have the attention span. Kids are really fun to work with because they have such active imaginations and they're just kind of naturally in that trance state. So they're
Yeah,
very receptive.
I know.
Yeah.
I know that they're talking more about working with meditation techniques, even in elementary school age kids, which I think is fantastic.
I was working with a 5-year-old last week and she said, "Can I show you how we hold peace?" And I was just wowed. I love that. We need to teach our children, meditative kind of techniques so they can manage the amount of stimuli that comes to us every day in our daily lives.
Well, that's just beautiful. Do me a favor and just tell our viewers a little bit about the process, kind of in general. What is involved when a person comes to you for help through hypnosis?
Sure. So the very first time I meet with someone, I'll spend a couple of hours with them. And that's so that I can take a really detailed history so that I can really understand the issue that they want to work on and how it's been impacting their life, how long it's been impacting their life, um, and just the more I know about that person and understand not just their motivations today, but even what they were like as a 6-year-old, um, the easier it is for me to be able to help them reach their goal. So that's a longer session, but we do hypnosis even in that very first session. That very first session is more about them getting that feeling of being in a trance state. We go into trance state naturally in and out during the day, just depending on what we're doing. But a lot of people don't realize that that's what's happening, that they're going into that maybe alpha brainwave state. And so they don't know how to do that intentionally. So I'm just guiding them to help them learn how to do that intentionally. And and once you've seen how you can do that intentionally and you've seen how deeply relaxing that can be, then it's much easier to do it the next time. So that very first session is all about just getting that experience of hypnosis. And then from there, just depending on what their specific goal is, um, we just continue working toward that goal. So the next time they come to see me, it's going to be about an hour and we're going to recap the changes that they've seen and where they need to go from here, and then do hypnosis again.
And then is that a process that goes over weeks or months or what's typical?
Uh, Typical, what I would say is that most people will see me for about a half a dozen sessions or less. I have some long-term clients that just stay with me because that's what they prefer to do. And some people uh, just are able to achieve their goal very, very quickly.
So obviously you're trying to get people to a point to where they're independent and can use the trance state kind of on an as needed or as what works best for them.
Yeah, absolutely. I mean, that's my goal. It's not intended to be a long-term process. And secondly, I want them to walk away with skills and abilities to be able to do this for themselves, because everybody has the ability to go into trance, to put themselves in trance. And even for me, when I was first learning that, that was kind of scary. I was like, if I go into trance, how am I ever going to get myself out? Um, so my goal is to teach them that they can do that and use that as a tool in their everyday life, to achieve anything they want to achieve, and just to relax, because it is deeply, profoundly relaxing.
So anybody that might have fears of loss of control, you can kind of help them understand that that's not something that's really too realistic for them to be concerned about.
Yes, absolutely. Most people they're either afraid they just can't do it because they've got such a chatterbox mind, or they're afraid that they're going to give over control to me. And so we do spend some time just kind of talking through that in that very first session too. And to me, the most fun is when I can help somebody who has that constant chatterbox going in their mind, and they're absolutely convinced this is never going to work for me. And at the end of the session, they get up and they're like, wow, that was kind of weird.
That is really cool.
And they're like, my mind has never turned off before.
Wow. So that even for the chatterbox minds, and in my practice, we see a lot of folks that quite honestly have just lost a lot of hope. Hope about being able to recover or be able to return to prior states of happiness and functionality. But I'll bet those are the exact kind of people that you enjoy working with.
Yes, because you can get to that point in your life where whatever you're dealing with is just seems so overwhelming that you give up. And that's a lot of what I'm doing, is helping people find that hope again. And particularly the kind of people that you're working with that have struggled for so long with, a particular medical issue, or chronic pain, or whatever that is. Um, but they have to be able to just break that cycle of expecting poor health or expecting pain, so that then what you're doing with them can be more effective and
Sure.
work more quickly.
And do you ever see issues with people that just feel truly not deserving of those kinds of outcomes? I see that, and sometimes I really struggle with those patients because I know our Creator doesn't intend that for them.
Yes, I mean, that's so common in our society. We grow up thinking we're not worthy, we're not good enough, we don't deserve um, that good health, or whatever that is, or abundance, or love, or whatever. And so that's where we get into a lot of the self-esteem work and self-compassion work.
So important. Do you ever find people that just literally can't be hypnotized, or that it doesn't work for?
So I would say in the 13 years I've been doing this now, maybe I could count the people that were not successful going into trance on one hand. Um, Very few instances where my client just absolutely would not let themselves go into trance, because it is a choice. You have to be open to letting yourself relax. Um, so we all have the ability to do it. It's a natural ability. We move into that alpha brainwave state as we start to sleep at night. So we do it naturally. But some people are really concerned about the control issue and just can't let themselves relax. But that's just not very common in my experience.
In your experience, do you find that some people get a lot better at it the more they practice it?
Oh, absolutely. I mean, this is the kind of thing that that's why I was talking about in that first session. I want them to have that experience of what it feels like, because once you know what it feels like to go into trance, it's so much easier the next time. And you can go into trance more quickly, and you can stay in that trance longer, undisturbed. So it's definitely the kind of thing that the more you practice it, the easier it gets. And I often have my clients practicing this at home in between our sessions.
Sure. So in doing some work myself with brain waves as
Mm-hmm.
a part of the work that we do with people's neurologic function, you keep referring to now alpha waves. I know that we're usually, like you and I are in beta, maybe we're in mid beta, but hopefully we're not in that anxious high beta state. But is it always alpha where people's brain waves show up on in the trance state, or do they sometimes go even to that deeper level, what we call theta?
Yes, they do go into theta when they're getting into a deeper trance state. But even if you just go into alpha, you're in that trance state. So,
So the kind of things you
because
want to accomplish for the body and for the mind will happen even in alpha.
exactly, exactly. If they get into that theta state, it's even more deeply relaxing. So I love it when people get into a really nice, deep trance, where they won't even feel like they hear what I'm saying sometimes. They'll lose me completely when they're in that theta state, but their subconscious is still listening. It still gets all of the messages.
I did an hour in one of those float tanks not so long ago, and they kind of advertise that it's to put you in the theta state. But wow, was that relaxing? And I think I was actually probably in a trance-like state during that as well.
So you were able to do that. I've done that one time myself, and it was relaxing, but I really didn't like having that that pod completely closed.
Kind of a closed-in feeling. You have to be able to deal with that. Um, so tell us about how your clients, once they become trained, how do they typically use their skills in hypnotherapy?
Well, ideally, I look at what I'm working with them on as teaching them a mindfulness technique that they can use every single day in their lives. So ideally, I would have someone use this every day to just sit down for maybe 10 minutes and just relax, just take time out, teach or get themselves in that trance state, and just take that break. You know, we live in a society that's unlike anything human beings have ever experienced, and we have so much information overload, so much just coming at us all day long, and we're not adapted to handle, I think, that level of stimuli to the degree that we are faced with every day. And so I see this as a mindfulness technique that I would hope my clients would practice day in and day out. And it doesn't take long. You can go in, once you've learned how to go into trance, you can go into trance very, very quickly. And just spend a few minutes there. It resets your body, it resets your mind, and then you're able to go back out into the world and do things that you want to do and concentrate better and emotionally feel better,
Do you
feel happier.
feel, yeah, sure. Do you feel like people that actually take advantage of getting into that mindful trance-like state more frequently actually do better overall than people that maybe have that as a skill but rarely use it?
Yes, um, I absolutely do, because um, I just think it's important to reground ourselves and recenter ourselves. And it helps us get more in that mindset of focusing on the positive. You know, we go through our days a lot of times and we're just so focused on everything that's going wrong and what we don't want in our lives. And just taking that time out to be a little more present and a little more mindful allows us to be more focused on the good that's happening.
I sometimes hear people, put up an objection that they just don't have the time to commit to, say, meditation, which we also talk to our patients about. But it
Mhm.
sounds like with a hypnosis, which you might even consider almost a meditative type of technique, that it can be very short. You don't have to devote long periods of time to it.
Right. One of my favorite books, and I'm gonna blank completely as I get ready to say this, but one of my favorite books is it's written by a physician and a psychologist, and together they are explaining just how these mindfulness techniques actually change the brain over time. And the whole point,
Neuroplasticity, right?
yes, exactly. And their whole point is just that it doesn't take 30 minutes of time every day or an hour of time every day. It just 5 minutes, 10 minutes over time, it reduces your anxiety permanently. It actually changes the chemicals in the brain.
I think that's been clearly shown. Yeah.
Mhm.
So let's talk a little bit. I know you and I both share here that what we've seen since probably when 2020 started, this real big change in people, the people that we work with. But let's talk a little bit about that and how that's impacted your work and what you've seen in your clients.
Sure. I think in the very beginning, everybody was kind of like shocked. It came on so suddenly. And so people were struggling with, how do I do this? How do I get my routines in place? How am I going to cope? And I was working with a lot of people on just that idea that you can change, you can do these things. And then after they started getting routines in place and kind of figuring it out, then I think what happened was people started realizing, oh, this is what we've got to deal with. This isn't going to go away. And then it started settling more into kind of that depressed state
Sure. Yeah.
and even some anxiety about, wow, can I really do this for a long time? And especially parents. I really feel for parents right now of young children that have to um, get them set up in online school again. And all summer they weren't sure what was going to happen and how that was all going to unfold. And we're still not sure. So, now I think we're dealing more with that kind of anxiety and just the depression that
Sure.
comes from not being able to get out and do our normal activities and be active and that kind of thing. So I'm doing a lot of coaching on helping people find ways that they can still safely interact with the world and do some physical activity.
Absolutely. As a doctor of environmentally acquired illness, first of all, we see lots and lots more illness than we've ever seen in the past, that we feel like it's directly related to the progressive environmental degradation that's going on around us. But also we've seen over the years that the people that have stress, and of course we all do, but stress actually triggers my patients into having more problems, whether it be fatigue or aches and pains or brain fog or digestive symptoms or immune suppression symptoms or hormone symptoms. And what I've seen is even many of the folks I'm working with that are actually doing quite well, during this period of the pandemic have actually seen a physical deterioration in many cases that's really just been a part of their lives. So it's really amazing to see the direct ties between our physical, how we do functionally and how we feel compared to the stress that's in our mind. I'm seeing it. And so for sure, helping people come to people like you and gain these techniques with using their alpha wave trance state, it can be very huge. And I'm also curious, Pam, I use a couple of passive techniques. I use a device called the ISIS microcurrent neurofeedback, which uses micro pulses to the scalp, and also one called Alpha Stim that uses micro pulses to the earlobes. I'm curious what your take is on some of these passive modalities as an adjunct to the active practice of hypnosis and hypnotherapy.
Well, there's different ways to achieve that state, right? And it's all good no matter how you go about it. You know, I always hope that people will learn something like meditation or hypnosis so that they can do that all the time on a regular basis in their life. But if you have techniques that can help them, you know, in other ways, that's great. It's all adding to that end result.
Sure. Sometimes having more than one tool in that relaxation toolbox is valuable. That's why, you know,
Right.
people can use exercise, or they can practice a hobby, or they can do things for other people in addition to, you know, the techniques you can teach them.
Right. There's no one technique that is going to address all of it. So the more techniques you're using, the better, I think.
Well, one thing that I know in my practice is coming up, maybe in yours as well, is people are a little bit having more difficulty to travel, or they're afraid to go out. Can you work with people at distance via telehealth?
Yes, absolutely. And to me, that's been one of the blessings of the pandemic, if you can say there are some blessings, because this works really well over video. And I don't think I ever would have tried video. I had some clients that I worked with just over the telephone, but had never tried a video platform before and was forced into that. And it really works very well. And I will continue always to offer video sessions to my clients now. One of the things I really like about the video platform is that the client can be in their home, and all of the good feelings from that session get linked to their home.
That's
To
cool.
their
Yeah, so that's their own climate. That's their own little micro environment. And if they can work within that, it makes it even better for them instead of being in
right.
a foreign
Yeah,
place. That's
we can just
really cool.
anchor those good feelings. Now, not everybody is able to, they don't have the right environment. For instance, I have a number of moms with, you know, several kids, and they're not going to be able to find a place in the
Sure.
house to
Two,
take an
two or
hour
three
out.
kids climbing up into their lap while they're trying to use hypnosis
Absolutely.
techniques might be a little difficult.
Right. So right now I'm offering in-person sessions a couple of days a week and video sessions the other days.
So then you must be able to work with people pretty much globally.
Yes, I can. And so, you know, that's just another advantage of being able to use that video platform.
Absolutely. I've always used telehealth as a environmental doctor practicing natural medicine, even before the pandemic, but the number of telehealth opportunities in my practice has gone up considerably, and I really don't think it gives virtually anything up.
Mhm.
Maybe we can't have the hands-on type of interaction with our guests, but I don't think that takes a lot away from it, you know.
Mhm.
So that is one of the few silver linings of everything we've had to be going through in the last few months.
Mhm.
Well, Yeah. Is there anything else that you'd like to share with our viewers about anything having to do with what you do to help people?
I can't really think of anything. I love what I do, and I think it's really beneficial. And however someone can learn these techniques and use these techniques, that's great, I think.
How can people get in contact with you if they want to learn more, Pam?
If you want to learn more, my website is Austin Hypnotherapy Solutions. It's a long one. AustinHypnotherapySolutions.com, and you can contact me through that website.
Awesome. Well, let's kind of end up maybe with a quick little tip. You know, I know that a few of our viewers might be kind of a do-it-yourself mentality. Can you throw out a couple of little tricks for somebody that might be viewing this and wants to just jump in and try something just right now?
Well, you know where I always start with my clients is with the breath. So I think just learning how to take some nice, deep, diaphragmatic breaths is the best place to start. And we got to breathe anyway. We're not using any extra time. So just forcing that deep diaphragmatic breath in as you breathe in through the nose and holding it. And then just that long, slow exhale out. And I always coach them to do to make the exhale twice as long as the inhale, just to briefly engage that parasympathetic response. And then when you're doing the deep breathing, I always say, don't do them back to back to back. So you do a deep breath, let it go, let your breathing go back to normal, wait a minute, then do another deep breath. And even 3 or 4 of those deep breaths at some point in your day will just make such a difference. We tend to let the stress build throughout the day. And if we can just use our breathing periodically to take that stress level down a little bit, it makes such a huge difference.
So that age-old recommendation that we've heard since we were kiddos to take slow, deep breaths and count to 10 when we get upset or anxious is really has a lot of merit.
It really has a lot of merit. It really impacts your body, and it impacts your mind, because when your body starts to relax, your mind quiets down.
Amazing. And you know, I just want to say from my perspective of treating people's aches and pains and other body maladies, that what you're talking about is probably the best way that I can achieve success in dealing with what my patients are coming in with. I mean, I think it's just every bit as important as any vitamin I can talk to them about, any diet change I can talk to them about, any lifestyle change. So I really appreciate you taking the time today to spend time sharing this with our viewers. And I just hope you have a wonderful day.
Well, thanks for inviting me to do this, and I hope you have a great day too.